Hello, I'm Vanessa, and I'm going to go ahead and go over Cushing Syndrome. Basically, the Cushing Syndrome is also known as hypercortisolism, occurs over time once the body has been exposed to high hormone cortisol levels. This is due to the effect of oral corticosteroids medication. An example of that is steroids in general. The body is producing too much cortisol itself. So, symptoms that a patient or a person with this syndrome may experience is obesity and weight gain. Basically, they also increase fatty deposits in your abdomen, your face, between your shoulders and your upper back. Some women may experience irregular periods. Also, a delayed rate of growth in children, and also excessive facial and body hair. Um, Also, purple or pink stretch marks around your body. It could be in your arms, your stomach, your legs, your thighs, your butt, basically anywhere. Um, Causes an increased level of cortisol in the body due to overuse of corticosteroids. Also, um, adrenal glands abnormalities or tumors of the pituitary gland. Um, there is an example here on the side, and basically it just shows the symptoms that a patient or a person may experience. Headaches, there's a moon face that they call is just basically weight gain around your face area. The buffalo hump is what they refer to as when you get the fat increased in your upper back or in between your shoulders. Um, you also can get acne, or not acne, but I should say is rashes all over your body. And in this slide, it just gives you a further symptoms of a person, an actual person, how their body looks with this syndrome. I've already went over the weight gain, the moon face, and the buffalo hump, etc. What is cortisol? Cortisol is naturally produced hormone. Cortisol is produced in the adrenal gland, which serves several functions in the human body. The adrenal gland is located at the top of the kidneys. This gland produces hormones that aid the human body in maintaining homeostasis. Stress relief, blood pressure, immunity. Cortisol helps regulate blood pressure, reduce inflammation, and keep the heart and blood vessel functioning correctly. An overview of the pathology part. The hormone, a hormone produced by the pituitary gland, that the cortisone production of the hormone, when stimulation by the ACTH, the adrenal gland, secretes cortisol and other steroid hormones. The ACTH released into the pituitary venous sinuses is response to stimulate caused by the cortisol releasing hormone, which is known as the CRH. From the hypothalamus, the ACTH is released in a adrenal pattern that is independent of circulating cortisol level. Peak release occurs just before awakening, and the ACTH levels then decline throughout the body. Cortisol of CRH and the ACTH release is maintained through negative feedback by cortisol at the hypothalamic and pituitary levels. Neuronal inputs at hypothalamic level can also stimulate the CRH release. Who is at risk? Basically, causes are most commonly known to include individuals from ages 20 to 50. Those who are at risk are those who have experienced long-term use of previously mentioned corticosteroid medication, or those who have had tumors in the pituitary glands or adrenal adenomas. Women are more likely to be at risk than men. Some drugs, function suppression, inflammation, use treatment, as far as asthma, allergies, and then this is just basically gives you a breakdown of what type of medications, what it's treated for, and it's just basically a whole bunch of steroid medication. Some are taken by mouth, some by inhalers or sprays, in the form of eye drops also. Some creams and ointments that can help heal many skin conditions because that's part of one of the symptoms, and also by injection. This form is often the injection is often used to treat muscles and joint signs and symptoms such as the pain and inflammation of the tendons. Diagnosis: patient's transparency of medication use is the first step in uncovering the Cushing syndrome. Further tests become unnecessary if one happens to be taking medication that cause Cushing syndromes. Common tests are cortisone tests that can be done. It basically examines the hormone levels in the body. Urine or saliva, and it measures to assist the mass production of the cortisol. Physical evaluation of fatty deposits, also CT scans, dexamethasone suppression test, MRIs, and in some cases surgery is needed. Petrosal sinus sampling basically determines whether the cause derives from the pituitary or somewhere else. Endocrinologist is basically the one who studies hormones. Moving on to the next slide, is this Cushing syndrome hereditary? No, it is not hereditary. Cushing syndrome patients tend to have occurred this condition sporadically. This means they have no previous family history of it. It's just developed. Pre-existing conditions and genetic may worsen it, but Cushing syndrome is more common in users of the corticosteroid medication. This can include those who use the medication to treat inflammation. Pre-existing conditions include tumors in the pituitary gland or the adrenal adenomas. And management of this disease, attentiveness towards one's health, preventing to ideal eating habits. So basically just eating healthy is one way of management, or a way to manage this disease. Also, implementation of light regular exercise. They say light exercise and avoid high impact exercise, as your bones may weaken and basically cause you to break a bone due to the medication that you have taken or whatnot. Avoid drinking too much alcohol. Take medication as directed. FDA recommends medication known to you as, or known as, I'm not sure if I'm going to pronounce this correctly, mifepristone. Brand name is Korlym. It's basically approved for use in patients with the diagnosed Cushing Syndrome who have type 2 diabetes or glucose intolerance. And other medication is known as Paceriotic. Brand name is Signifor. Approved for treatments of patients who pituitary surgery is not an option or has not been curative. The epidemiology is relatively uncommon in general population, which incidence of 0.7 to 2.7 million of the population per year. The adrenal anemosis occurs for 0.6 million of this. The female/male ratio is 3:1. So females is 3 and the male ratio is 1. And then more than 10 million Americans receive pharmacology doses of the glutinosis each year. So Cushing syndrome must be more common than any other cause, but is seldom reported. The prognosis for this syndrome: with surgery, the patient is most likely to overcome the effect in Cushing. There is a possibility that tumors can reappear after surgery. Favorable odds overall without treatment is fatal. Untreated to 5 years is a fair life expectancy of those affected. Life-threatening, yes. Fatal only when untreated. A history on this syndrome was discovered by an American neurosurgeon, Harvey Williams Cushing, in 1912. So basically, that's how they got the name, the Cushing syndrome, because this neurosurgeon's last name was Cushing. Cushing had a patient with unique abnormalities in 1910. Uncertainty of conditions caused a 40-year-long dispute over it. In 1933, with advance of technology and surgery, neurosurgeons could now operate for this Cushing syndrome. Here is a fun fact. There is a celebrity, Spencer Bell, died from this disease at 20 years old. Death year was in 1935 during his early stages of this discovery. So he died at a really young age. So I'm assuming that this syndrome was just discovered, and that's probably what causes death. Not only the syndrome, but it was new discovered. He starred in the original movie of Wizard of Oz, and was able to find this picture of him. I also included this video. It's just basically an overview of the Cushing syndrome, and I'll go ahead and play it.
Cushing syndrome is a condition where the body produces too much cortisol, which is basically steroids. The adrenal is a source of steroid production, and our bodies need steroids to function normally. When we have stress, our cortisol levels increase, and that helps us to accommodate that. But occasionally, patients will have a condition where the adrenal will overproduce steroids in excess of what you need. And when that happens, it's sort of like being on prednisone, if you've ever had somebody on that, where they can get some puffiness, they can get weight gain, they can get weakness, it can cause osteoporosis or high blood pressure. It can cause a lot of symptoms for patients if that were to occur. In some cases, that's related to a mass in the adrenal gland that's overproducing the steroids. And if we can identify that and remove that adrenal gland, we can fix the problem. And patients can get resolution of all those symptoms. So anytime somebody has cortisol overproduction, it's important to evaluate the adrenal as a potential cause and determine if surgery is the appropriate treatment.
And that is it. That's basically all the information that I was able to obtain for my for the Cushing syndrome that I went ahead and selected. I personally myself have not seen anybody or known anybody with this syndrome, but sometimes I do. Now that I am familiar with this with syndrome, I do see people, with the thin legs and the bigger upper body and the skinny arms, which then you start to think like, oh, okay, maybe that person, I'm not a doctor, but maybe that person might have something to do with the Cushing syndrome, or you just see the symptoms and you get your thinking as to, oh, okay, maybe they have something to do with Cushing syndrome. But overall, this Cushing syndrome does look painful. The stretch marks on your body, the rashes, the skin irritating, also the facial hair, and all that stuff. Seems a bit overwhelming for patients with this syndrome. And that's it. Thank you.